Well, good morning. Welcome and thank you for tuning into WHLI Health Talk. I'm Dr. Victor Politi, President and CEO of New Health, the Nassau University Medical Center over in East Meadow. So as healthcare in America is changing, New Health is part of that change. This half-hour program will provide you with the essential information about our services and facilities that provide top-quality care that fits into your lifestyle. New Health's roots go deep into Long Island's history. What began in 1935 as a 200-bed general hospital has now become part of a unique health organization with multiple centers of care and a commitment to deliver excellent essential care to everyone at every stage of life. So we're absolutely dedicated to being the finest healthcare institution in Nassau County. We provide a full spectrum of world-class services. Our improvements are making us a leading provider of primary and tertiary care services that rival the best in the country. So good morning, everyone, and thank you for tuning in. Today we have an excellent guest, Dr. Jack Levine. He's an MD over at Nassau University Medical Center. He's also a pediatrician, but he's our director for the Center for Autism. We know autism in Nassau County is really prevalent. Everyone has a friend or a relative that's, I guess, afflicted or suffers from autism. And we at New Health are involved very deeply with the treatment and the diagnosing of autism, as well as referral to many different services that children with special needs might need. So without further ado, Dr. Jack Levine, thank you very much for being here today.
Sure, it's my pleasure.
Yep. Why don't you tell us a little bit about yourself and about your practice?
Well, I'm a general pediatrician, and then I did a subspecialty training in developmental behavioral pediatrics, which is involved with taking care of children with developmental, emotional, mental health concerns such as autism, attention deficit disorder, learning disabilities, language delay, and other disorders like that. Also children that have intellectual disability and cognitive delays as well. And what I do is I try to help diagnose and evaluate the children and outline for the parents what sort of plan the children need, help them get what the services that they need, refer them within NUMC to the other subspecialties. That's a 3-year fellowship now that you do after you finish pediatrics. I went to Albert Einstein Medical School, then I went to Long Island Jewish for my residency, and went back to Albert Einstein for the fellowship.
In child development?
In developmental and behavioral pediatrics.
So you're an MD. So you see a lot of doctors associated with autism and with developmental problems, and most of them are PhD psychologists. So you're an MD, which gives an added, I guess, dimension to this. So you're a medical doctor. So you're a pediatrician. So you look at all different medical causes, any types of medical problems that might be underlying some sort of developmental delay as well, right?
Yeah, that's a really good point, because the field is very multidisciplinary and interdisciplinary. So there are a lot of people with psychologists, speech therapists, occupational therapists, and there is a real role for medical doctor and pediatricians. I mean, we pediatricians, we see children without developmental problems, and so it's a lot easier for us to kind of figure out what's going on. Plus, we're very good at working with families. So a lot of times developmental pediatricians and sometimes even primary care pediatricians will be the care coordinator. They'll be the medical home for the child. And at New Health, we try very hard to be that medical home, to provide a wide range of services and a wide range of advice working with the family. I mean, the family really know their child the best, but we work with them and try very hard to get them the services that they need. The other thing about it is that the school system is really, when the children get older, is really where they get a lot of their care. And yet there still is a big role for the medical practitioner and provider to help the schools know how to take care of the children. So.
Yeah, absolutely. It's such a complicated illness, if you want to call it, or a disease, or autism. Why don't you tell us a little about autism or the autistic spectrum, and what does that involve?
Right. So autism spectrum disorder, which is called now, really involves 2 major components. The first is significant deficits in social interaction or social communication. So that could be, some children with autism don't talk at all. They're essentially nonverbal. Other children, they will make no eye contact. They really don't understand that interaction between people and how the world works by social interaction. Others have trouble making friends. They can't carry on conversation. They don't understand nonverbal communication, how people, when they sit, how they hold their hands. They don't know that. They have a lot of trouble getting along with others, carrying on conversations. The other aspect of it is unusual, repetitive, perseverative behaviors that are essentially not particularly productive. So that can range from children who will sit around and twirl bottle caps all day to children who are preoccupied with the moons around Saturn and what their mass are and what they're made of. And the thing about this is that it interferes with their normal day-to-day activities. It interferes with their ability to learn in school. It interferes with their ability to interact with other people and do what other people want to do. The other part of this behavioral component is resistance to change. People with autism are kind of very stuck in their way. They don't really see the world in a broad perspective. They're kind of stuck in their own head, and they want to do things when they want to do it and how they want to do it, even if it's not an appropriate time to do it. Another component is the sensory issues. So a lot of kids with autism are very sensitive to sound, light, texture. They have trouble wearing clothes. They don't like to have certain textures of foods. And this all, as you can well imagine, interferes with every aspect of their life. So it can be also associated with intellectual disability. So many people with autism have lower IQs and have difficulty with educational material, while others don't. And they could be extremely bright, but just unable to work their way through the world and how the world works. So, you know, there are kids who are in special education who are in very small classes who need constant supervision, and there's young adults with autism who have 2 master's degrees but who can't get a job because they just can't function in the workplace.
Now, I mean, this is really a hot topic. I mean, today's show, probably is going to affect a lot of people. And I think a lot of people are going to listen to this and tell their friends about it because they're all affected in some way by this autistic spectrum. So the things you're saying, I guess, to educate our parents and our friends, what should we do with children? I mean, what's the, we have a young child, they're not developing the way we, which our primary care physician, our pediatrician said there's something going on here. We want you to follow up with someone like yourself. What's the next step then? What happens?
So, the push nowadays is to identify autism early. And the reason for that is because early intervention, intense early intervention, is very effective in improving outcome. So we're working very hard to identify children as early as possible and to get them into services. So if someone's concerned about their child's development, they speak to their pediatrician usually. Many pediatricians nowadays do developmental screening, and they do autism screening, which is recommended by the American Academy of Pediatrics. The first developmental screening is at 9 months, and then at 18 months, and then at 24 or 30 months. And autism screening is at 18 and 24 months. So if we're lucky enough to pick up a child that early, the first thing that should be done is they should be referred to early intervention. The early intervention system is administered by the county. It's administered by Nassau County. It's a very good program. We at New Health, we work very closely with them. The children are evaluated. They are not diagnosed, but they are evaluated. Their developmental scores are figured out, what their delays are, and then they're assigned therapists, usually at their home. So that should happen first. Then the diagnosis of autism could be made or suspected by someone like myself, a developmental pediatrician. Sometimes neurologists do it. We have a number of pediatric neurologists at the hospital. We have another pediatrician, Dr. Dole, who's in the Child Development Center, who is also able to do that. And then we can then advocate for the family to provide intensive services, because the younger the child is, the better the outcome. So the kind of services that we want to get are speech therapy, special education, occupational therapy, physical therapy, but in particular we need intensive behavioral intervention services to try to get the child out of that pattern of behaviors that I had mentioned. Mm-hmm. Then, when the child becomes 3, they go to what's called the Committee on Preschool Special Education, and that takes care of children from 3 to 5. So 0 to 3, birth to 3 is administered by the county, 3 to 5 is administered by the school district. But the children are usually then evaluated for further educational intervention, where again they are usually, a child with autism would be in a full-day program at the age of 3. Mm-hmm. Again, with intensive behavioral intervention, special education, speech therapy, occupational therapy, sensory services, physical therapy, and also extremely important with the management of children with autism and treatment is parent education and parent training. Yet it's important for all children with special health care needs to have families that know what's going on, but there's something about autism that the more educated the parents are and the more involved they are in with the child's treatment, the better the outcome. Mm-hmm. Then after 5, they go into the Committee on Special Education, which is a regular school district, where they are provided with services until the age of 21. Okay, in special education you can go to 21. Now, some of the kids are in regular classes. Some of them are in classes that have some children with developmental problems and some that don't. Some are in what's called self-contained classes, and many go to BOCES, mm-hmm. the special education program in Nassau County and in Suffolk County as well. And those are very specialized programs. Now, at home, we also would like to get services for the child. And at home, you can have all the individual therapies can be provided at home, or they can be provided outside, like at the hospital. And then there's a special kind of behavioral intervention called applied behavioral analysis. Applied behavioral analysis is very intense one-on-one behavior modification services that have been shown to be extremely effective in changing the behavior of children with autism, whether it's getting them to have better eye contact, to sleep better at night, get toilet trained, play more appropriately with toys, not fight with their siblings. And those services, recently there was a law in New York State, the New York State Autism Insurance Act, which states that all the insurance companies in New York State, except for self-employed and federal programs, have to provide and pay for all the services for diagnosis, evaluation, and treatment of autism. So parents should know that, and if anyone's listening, you should know that if you call your insurance company, they must tell you the name of a provider for applied behavioral analysis. So basically, you know, that's the kind of services. I guess it's on the medical side, we do make an attempt to find out what the cause is. There are certain disorders that actually cause autism. The most common genetic disorder is Fragile X, which is relatively common in as far as these things go, but certainly not very common genetic cause for autism. And then there's a number of other more rarer causes. Now, we have a very good geneticist at the hospital, mm-hmm. Dr. Tagay, who really works very, very hard to help find out why a child might have autism. And this is important for a couple of reasons. One reason is because it's nice to know, and parents want to know why, and they should know why. And the other reason is because sometimes if we know what caused it, we kind of know what the natural progression is, and there may even be a treatment for it. Often there's not, but at least we know. And plus there's also implications for other children in the family and for mm-hmm. future children. Mm-hmm.
So we have those services at Nassau University Medical Center. We have the neurologists, we have the geneticists, pediatricians like yourselves that have expanded training in behavioral development.
Right. We also have physical medicine mm-hmm. and rehabilitation services mm-hmm. there. We have the outpatient child mental health mm-hmm. clinic with psychiatrists and psychologists. Mm-hmm. Sometimes medication mm-hmm. Is necessary. We try hard not to prescribe medication, but sometimes it's necessary. Sometimes I can do that, and other times we refer to the child psychiatrist. They have very active child psychiatry program. They have child psych fellows that we work very closely with. We have a good relationship with them. We share patients. We share patients with genetics, neurology, pediatrics, developmental pediatrics, psychiatry. We have ophthalmology. The dental clinic will also see the children. It's some kids with autism are very, very difficult to examine. Everyone in the hospital makes their best effort to make a calm, supportive environment when they see the kids with autism, to try to get them to be as cooperative as possible so that they can get the best evaluation. We have a separate waiting room in the developmental pediatrics clinic, which the hospital was nice enough to set up so that the children can kind of be off to the side in a more quiet environment.
That's so important that these children, even in the emergency department, we establish certain areas so that if a child, with one of these developmental disorders come in with a laceration or a broken bone, kids are kids, they get hurt, and they come to the emergency room, and so we have a separate area to put them in, a quiet area, because we don't want to get them excited. And I know with your department, the same thing, you have separate quiet areas, and with building that new primary care center up in National University Medical Center. If anybody's driving by on Hempstead Turnpike, you could see right there on the first floor, it's a $24 million expansion of a primary care. It's going to be beautiful for pediatrics and for autism, and then you'll have your own little area with your own little waiting room for these children. And this is such a huge, Dr. Levine, this is such a big issue here in Long Island that, it affects everyone, including myself and my family. And you deal with your relatives and your friends' children, and they're playful, and they're fun, and they're beautiful, and they're just so full of love, and you just want to do everything you can to help them. And so they're just such beautiful children. And know that National University Medical Center has all these things. Right. Who would know? I mean, here's this big building, it's a trauma center, and that's where you go when you have your heart attack or your stroke or, whatever, but you don't realize that the other services that we provide, the outpatient services that we provide for children, in all specialties, whether it's pediatric cardiology, pediatric endocrinology, allergy and immunology, we have all these pediatric specialties in that building. But yours is so important to Nassau. Is there an increased incidence or prevalence in Nassau? I mean, it just seems that way.
That's a good question, and I can't really answer definitively because, believe it or not, there's never been a study to look at the prevalence or incidence of autism in Nassau County, but probably not.
It just seems that way because we're a younger community and we have more, children, or are we diagnosing it better because we have a higher, educated population?
So that's a good point, and it's in some communities, it's diagnosed readily and easily, and people have access to multiple resources. They can get second, third opinions. And in other communities, it's underdiagnosed because the insurance isn't as good. There's underinsured people. They don't have the access to the kind of medical care that other people have. And that's what we're trying to do at New Health. We're trying to make it so that everyone can get that kind of care and everyone can get diagnosed.
Is this expensive? I mean, does insurance cover all these types of treatments? Does insurance, all these specialists that we're talking about, does the insurance pick up those costs?
So it's very, very expensive.
Yeah, it is.
Very expensive. And in fact, it was so expensive that they passed a law in New York State mandating that insurances must cover. Now, most private insurances will do it. Medicaid is still lagging a little bit behind. But first of all, the diagnosis can be expensive, but it doesn't have to be. You can go to places that could spend hours and hours to make a diagnosis, but in my opinion, that's not really necessary. And those type of multidisciplinary hour-long evaluations are very expensive. Now, there is a role for that, especially if the child is confusing or there's a question about treatment. Kids with autism, excuse me, have a lot of other associated problems. They have sleep problems, they have stomach problems, they have seizures. And so they often see subspecialists. That's usually picked up by insurance. But a lot of the behavioral stuff, a lot of the applied behavioral analysis, a lot of the therapies are not. And there's caps in insurance, there's co-pays, And a lot of the insurance companies sometimes have difficulty covering all of those services. So parents often need to be in the know.
Mm-hmm.
And in fact, it's so expensive that in New York State, there's a special waiver. It's called a Medicaid waiver through the Office of People with Developmental Disabilities. And what it does is it says, we know that it's so expensive, but we really want you to provide the best care for your child, so we're going to give you Medicaid, regardless of what your income is, to help pay for all these services. That's something that we help families get. It's not easy to get. We have worked very, very hard over the past 5 years and have really developed a way of doing it that is relatively effective. And we have a number of people who can help with that.
And that's important. At National University Medical Center, we have those people that can find those coverages. One thing about us is we take care of everybody, whether they pay, they don't pay. If you're sick, whether it's some sort of psychological problem or you were shot with a gun, or you come to our hospital, we're going to do everything we can for you, like you were paying gold bars. I mean, nobody even asks what kind of coverage you have. We just do it, and that's why sometimes we're in such bad financial shape, because we're that hospital. We're that hospital that we will take care of you and not worry about the cost. And then afterwards, go after, try to get you insurance. If you don't have Medicaid, we have specialists that'll go to your room and get you Medicaid, emergency Medicaid, or something along those lines. So for autistic children in the poorer communities, we want them to come. Bring your child in. We want to see those kids. We want to help those kids, and we'll worry about the Medicaid, and we'll worry about what needs to be done. We have a lot of undocumented people, in Nassau County. You don't believe that, but there are a lot of undocumented patients, and they come to our hospital, and we know that, and we welcome them and we take care of it, because that's our mission. Our mission is to take care of everybody, and not only just take care of them, but give them the best services. I mean, we got some of the best cardiologists, best neurosurgeons. Our CAT scan is beyond. It's a 320 slice CT in the. I mean, we have some of the best equipment, and that's not just limited to people that can pay. It's for anyone that comes to our hospital under any circumstance.
One of the reasons that I came to work at NUMC was because of that. It is 100% true. Every single person who walks in there is taken care of, and it makes no difference what their insurance is. And we try very hard to work with them. Just the other day, a woman came in who had Medicaid. The child needs that kind of ABA, behavioral services. We have in the hospital one of the Medicaid providers has a little table that helps families. We walked over there. This is a true story. We walked over there. We discussed. I said, this child needs applied behavioral analysis through this provider, which I guess I'm not going to mention. And 15 minutes later, the mother knocked on my door and said, "Thank you very much. They gave me the name. They're going to provide services for me."
That's great.
Yeah.
Give me that person's name, because I want to promote them and get them to do everybody else in the hospital. Because that's a great story.
Yeah, I know. It was really very, very nice.
Yeah. Because it's such a and we have a lot of partners. You have a lot of partners, a lot of behavioral health partners, psychologists, and different types of patient advocates that you work with, and it's a big team. You guys all have to work together, for that patient. Now, how do you who quarterbacks this? Who puts all this together?
It just kind of happens. I'll call psychiatry. Psychiatry will call me. We do work hard at developing the relationship between the different subspecialties. The pediatric neurology works extremely closely with pediatrics. We have, over the last 5 years that I've been there, we've worked very hard with child psychiatry to develop. The child psychiatry fellows spend 4 months of a year working with me, so that's become friends.
Right,
and then
sure.
We know them, and I know the attendings, the geneticists. We all come to the same meetings. We have conferences daily. The endocrinologist, the cardiologist, and we work it out. We all work very hard to coordinate the care. We also work with social service agencies in the community, which are essential to these families.
Right.
And we have to have those connections as well.
And you do a lot of work with outside agencies. You were mentioning before all these different types of agencies that work with these types of children out in the community, children with behavioral development disorders, where you guys have a close relationship. You refer to them, they refer back to us, back and forth.
We work with the Long Island Center for Independent Living. They have an alliance for Latinos with disabilities, the Hispanic Counseling Center, the Nassau-Suffolk Law Services, the Long Island Parenting Center, Long Island Advocacy Center, all sole purpose is to help families with children with developmental problems get the services that they need and help advocate for them.
Right. So children, as they grow older and they go into high school years and they're becoming young adults, they're presenting a different set of problems. And as children are aging out of some of these services, what's available for young adults?
So transitioning from special education to post-secondary education is a huge problem. And sadly, there are not anywhere near as many services as there are for younger children, but there are services. There are agencies that help families, help them get vocational training, like VESID, which is a county or a state organization. Many of the universities and post-secondary educational settings on Long Island have special programs for children with autism. Nassau Community College, Adelphi, Post, New York Institute of Technology. And we try very hard to refer to those programs. When children are in special education, at the age of 14, the federal law says that they have to start transition planning. So theoretically, between 14 and 21, there will be 7 years for them to work on what they should do. Sometimes it happens and sometimes it doesn't. But we really have special knowledge of that at NUMC, and we can often direct families to the appropriate places. So some of the kids go to college, and some of them have minimal amount of help. Some of them have special programs. They need a huge amount of help. Often they will get some kind of vocation, they could work in drugstores, they work in grocery stores. Sometimes they need to work in what's called sheltered workshops, where they just work in a very supervised area. And some of the kids who really have difficulty with that are in day habilitation programs where it's like a continuation of their school program, and they go into the community, they learn to walk in the community, work their way through daily activities, and many of them will be living in residential placements, although there's a tough shortage of residential placements for kids. And families are often faced with very, very difficult questions about what they're going to do. Should we put our child in a group home, in a residential placement? Is his sister going to take care of him? Is his aunt going to take care of him later in life? And so those are things that we also talk about as the children get older.
Such really tough decisions, and it's such a tough disorder, this whole spectrum, and there's so many people of all different backgrounds trying hard to work with these kids to give them a great start so that when they do reach those the older ages, that they have some foundation of which to grow and to get some sort of job and make some money and carry on their lives and as much normalcy as possible. And look at all of us and the craziness we go through. Is there such thing as normalcy with all the crazy things I see in the hospital every day and things people do to themselves? And this is something that needs to be that we need to think about, and we need to try to help these kids so that when they do get older, we have some options for them.
I always tell people when the child is, or when they speak to me, if the child is diagnosed, yes, they have autism, but I say it doesn't mean they're not going to have a good life. You can have a good life, and you will have a good life.
Yes.
And what a good life is to everyone, like you're saying, it differs a lot. There's no reason why a child with autism can't grow up and have a good life as an adult.
Well, let me tell you, this was amazing, and I know everyone who's listening wants to hear more. I mean, I want to hear more, and so I'd love to have you back. I mean, we'll talk about some of the other programs that are out there, and maybe get some other guests from some of these programs to talk to us as well, because this is such a hot topic, and it affects every one of us, every day. So, Dr. Levine, I want to say thank you very, very much for being here this morning. And to everyone out there, thank you for listening. Dr. Victor Politi over at the National University Medical Center. I have this show on the Saturday mornings, and we try to bring someone interesting like Dr. Levine in here to talk about, what's happening in healthcare today, and some of the issues that face us in our daily lives. So I just want to say thank you very much for listening today, and I want you all to have a great, healthy day. Do some exercise, get out of the house, and stay healthy. Thank you. Goodbye.
Thanks.